Continuing with the lectures of thanatology. In our previous lecture, you have been taught about the early changes and immediate changes after death. So can anybody tell me what are the early changes after death, which happens? First of all, nee, that is an immediate one. What are the early changes after death? That is also immediate change. Early changes, shabash. Loss of temperature, that is known as algor mortis. Then liver mortis, rigor mortis, and then further go on. Okay? So these are basically, first of all, immediate changes, you know, all the reflexes lost, breathing stop, heart circulation, and all the things are in immediate changes. Then in early changes, you know about the contact flattening, which we will discuss today also, cooling of the dead body, or known as the algor mortis. Yeah. Then human body does not behave like a metallic object. You know about that. You know about the two graphs. One is for the metallic one and one is for the human body. The shape of the graph in the human body in postmortem cooling is of what? It's it's known as sigmoid shape. Okay? And in case of metallic object, it's a simple exponential graph like this. So that is for the metallic object because a body doesn't cool like a Newton's law because of various factors. You all know, you have already discussed these things. Then this is the sigmoid shape, and this is a very frequently asked Viva question, that what is the shape of the graph in case of a human body when it is getting cooled. Then the temperature recording. What is the name of that thermometer which is used? No, rectal is the way. No, the name of the thermometer which is used for the dead body temperature. Thanatometer. And normally it is placed in the rectum. Why? Because we want the temperature from the core. And in case of sexual assaults, what will we do? Lower part of liver में we normally subhepatic एक नॉच जगह बनाते हैं और वहां से you record the temperature. Then what was the postmortem caloricity? Anyone know about this? Normally what happens when after death the body either have this constant temperature for some times and then started losing the temperature. But in various conditions like for example infection, septicemia, strychnine poisoning, where the body started to have rise the temperature 1 to 2 degree for first 2 hours, ठीक है, और फिर उसके बाद further उसकी normal cooling start होती है. That is known as postmortem caloricity. Is not a common phenomena. Not all the dead bodies follow this. There are various specific situations in which the postmortem caloricity is there.
If you like my video, please subscribe to my channel and press the bell button to receive all the notifications. And my channel name is Dr. Javed Iqbal Kokar, Lectures on Forensic Medicine.